Welcome, and thank you for joining us today for our business spotlight on AxioBionics. We're going to get started with some housekeeping details. Feel free to ask questions throughout the event in the Q&A section on your Zoom interface. Time is also reserved at the end of the event to answer questions. And if there's a question that doesn't get answered, give us your name and we promise to get back with you. Closed captioning is available by selecting the CC closed caption button and then showing subtitles. And feel free to contact Zoom for technical assistance via the Zoom Help Center. And please be patient with technology. We hope that we won't have any glitches today. I want to also thank the team that has been part of this business spotlight. Thank the interpreters who are here, the behind the scenes team, Tyler Gross and Craig Sanders, and my colleagues from the disability management team, Lindsay Randall and Christine Roberts. And I'm Lisa Bartley. I am the business relations consultant for Region 9. And now I'd like to tell you a little bit about AxioBionics. AxioBionics came to MRS seeking job candidates, and we talked about the different positions they had. But once I got to know this company and learned about their technology and took some colleagues for a tour of the facility, not only did I want to share the business opportunities, the job opportunities with my colleagues, but I also wanted to share about their technology. They have a very unique business, something I had never heard about, and thinking that this will be a little bit different than your average spotlight, but also some information that's going to help you to do your job. So first, I'd like to introduce Philip Muccio, who is the founder and CEO of AxioBionics, one of today's top medical technology innovators, whose work has helped redefine the way quality of life is improved in traumatic injury patients worldwide. He combines a background in prosthetics, orthotics, and a keen eye for medical electronics to engineer custom-designed wearable neuroprosthetics. And yes, neuroprosthetics is a word I can say now, but when I first learned about it, I had no idea what it was or even how to say it. Philip's own disability has motivated him to research ways of improving the science of neurorehabilitation. He has been a customer of VR and worked with VR in other states. His work has achieved prominent success for individuals with spinal cord injuries, traumatic brain injuries, and other debilitating conditions. His patented concepts of applying controlled and strategically placed electrodes within a garment for long-term exposure has become a game changer for patients suffering from pain and paralysis. Philip Muccio received the 2019 Cranes Healthcare Heroes Award, the 2020 Marion Kit McDonald Closing the Divide Award. United Cerebral Palsy of Michigan and UCP of Metro Detroit have also recognized him for his longstanding commitment to individuals with disabilities. I'm excited for Philip to share his life-changing technology with us today, and I give him the floor. Thank you.
Well, thank you very much, Lisa. I'm pleased to be able to speak and present AxioBionics technology. We have much in common. We both desire to help our fellow man get reduce their disability, and ultimately, ideally speaking, we'd love to see people become productive members of society and get back to work. It's difficult enough to be in the workforce, even without a disability, but when you compound it with a disability, now you're escalating the challenge, I would say. So it was my passion from an early age to be able to reduce that challenge. And I found myself developing a technology that I call wearable therapy. And that's what I'm going to speak about today and give you a little bit of background into what that is. We have a very long history of working with VR, and the result is that, of course, if we can reduce the degree of disability, of course, people would like to return to work. Of course, people would like to entertain having a higher quality of life. That's ultimately our goal. So this technology I call wearable therapy, it is something I coined in the late 90s to be able to bring this technology to the population as we, across the nation, of course, we can do that. And I'd like to be able to, tell you a little bit about its goals and who would be a good candidate. What is it? Basically, wearable therapy is wearable electrical stimulation. Some of you know about this or know about electrical stimulation. We specifically make it wearable. And when you do that, it really opens up the possibilities. But the electrical stimulation technology, in contrast to bracing, which is something we all know about, it definitely encourages muscle activity. And that helps our individuals stay healthy and be able to move their body in a more efficient manner. Some of our patients have lost a good degree of neurological function. Many of them will be paralyzed either from a brain injury or a spinal cord injury. And we help to replace that lost neurological function so that in the end, our arms, our backs, our legs work better. Some of our patients will be afflicted with pain, and that is a significant problem, of course, because without having pain under control, it can really degrade your quality of life, decrease your movement, and you won't have the ability to work. Or if you can work, it'll be degraded to a great degree. So when it comes to people with chronic pain, our goal is, number one, to reduce that pain. And of course, you can do that many different ways, but we think we have a very good approach to doing that. Number one, we can reduce pain very fast. So upon visit number one, usually we're having pain relief within 10 to 15 minutes. And that, of course, is a huge advantage. We don't have to wait for days, weeks, or months to achieve this. We can achieve that very quickly. Many of our patients are going to be afflicted with muscle spasms. This is something that often accompanies chronic pain, and that can be very significant. That can restrict range of motion. That can keep the cervical spine, the head, from being able to rotate to the left, being able to rotate to the right. And so, for example, if you can't do that, you really shouldn't be driving because you can't rotate your head to see your field of vision. Wearable therapy is non-drug, non-invasive. We very much like to reduce the risk associated with pain control, and we like to see the benefits in the stratosphere if we can. No detriment to cognition. We don't have any effect on thinking, which is very good. Nobody wants to be clouded. Many of our chronic pain patients will have difficulty sleeping, and so we want to be able to address that. And we want to be able to control something we call activity-related pain. Activity-related pain is simply pain that rises upon further activity. It could be increased sitting time, actually, could be walking or standing for long periods of time. And when that happens, and of course, this is all associated with work, pain will rise. And if pain does rise, then you're going to be left with a substantial increase in pain, and that's not going to be very good. And we can fit these suits within just a few visits. So the duration of time to be evaluated and ultimately to be fit is very few in numbers. How do we help people with paralysis? Well, most of our people are afflicted with atrophy and weakness. We don't think of muscles being important in somebody who's paralyzed. We think, well, we'll just have them sit in a wheelchair and all's good. That is not the case. Muscles are designed to be very helpful for a variety of things to keep you healthy. But of course, that they're very important for movement, for all kinds of functionality. Foot drop, as an example, some of you may know what foot drop is. We can control functional aspects of the foot. We can improve arm function to help people use their arms bimanually, for example, and that could also be very helpful. We can also reduce chronic pain in the paralyzed individual. Now, it may seem counterintuitive, but people with paralysis do in fact have a fair amount of chronic pain, and that combination can be disastrous. It can really reduce quality of life. Muscle spasms and improvement to blood flow, very, very helpful for these folks. So as you can see, we're not just focused on function, but we are focused on health. We want to keep our individuals healthy because at any given time, your body can break down and that can disrupt the ability to work. Now, one of my first clients came to me in 1995, and of course, everybody knows the story. Ultimately, Christopher Reeve succumbed to his injury, but he was very active during the 9 years of his life post-SCI. But what people don't know is that behind the scenes, wearable therapy was active, keeping Mr. Reeve healthy. And that was very important because if you don't have a healthy body, you can't focus on the activities and the things that you want to do in life. You're challenged. You know, you want to be able to focus on your living, not on the disability itself. Who should use wearable therapy? Well, those that are afflicted with paralysis come in all different sizes and shapes. And we have spinal cord injury, which of course can be widespread. It can leave you completely paralyzed or partially paralyzed. A traumatic brain injury, same thing. And these other conditions, they represent degrees of paralysis. Amputees in pain don't necessarily have paralysis, but they lose their muscle connection, and therefore their muscles atrophy almost in the same way that someone with spinal cord injury, and that can be problematic as well. So we want to address weakness in arms, decreased arm function, sitting difficulties. If you can't sit for a very long period of time, that's not going to help you in your productive life. Walking to and from your work, also very important. If you can't get to your work, that's not going to be helpful. Spasms can interfere with life in a big way. That can definitely interfere with so many things: sleeping, driving, sitting and working. Definitely. Chronic pain, as I mentioned, also a big issue. You can't focus on your work. You can't get past the pain itself, so you can't be productive and concentrate. So we work with people who have chronic pain. Typically, we would work with somebody with pain levels that range between 3 and 10, 10 being the most severe possible. We see this commonly, believe it or not. This is something you would think is not possible in the 21st century, but indeed, there are many, many millions of people who live day to day with this kind of pain level. And we're trying to get these folks to go back to work, but of course, in pain, that's not an easy task. So what you want to do is, the ideal thing is to be able to lower pain to at least a 3. That would be ideal, because when you're below 3, you can you have very little interference in your activities of daily living and your work. So 3 would be ideal. 0 is the most ideal, and we do achieve that in many of our cases. But did you know that pain can increase upon extended sitting, standing, walking, all activities related to work? And we don't like that, because that's going to put you on the, if your pain increases to say an 8, that's going to put you on the couch. You're not going to be able to work. Activity pain tends to force people into absenteeism, presenteeism, and that's not going to be very helpful to the employer. So we want to remove that barrier as much as possible. Those that are in pain will tell you that pain will interfere with their concentration. And many people, believe it or not, who come to us have been down the road of trialing various things for years and have undergone failed treatments. That doesn't necessarily mean they're going to fail Axio's product. So we have to always evaluate people to see if what we do is going to work. If pain relief is not consistent, there is a reluctancy to try to go back to work. People don't want to give up their reliance on social services and monthly income. So I always believe in a very graduated approach. People who get out of pain may feel better, but they still may have the psychological overlay or impediment to going back to work. So we often see people trying part-time work, and if that works, they'll go to full-time. Now, I wanted to give you a very broad overview of the kinds of individuals you're going to see. This is what we typically deal with, and you can see on the left side, you have just one or two muscle groups that are paralyzed, and on the right side, you see the entire body paralyzed, and you're going to see so much in between. The dark purple represents complete paralysis. The shaded purple represents incomplete. So you can imagine when patients come to us, it is our job to fully analyze and discover what is going on and where we might be able to help. You know, you can imagine people, if they have some degree of paralysis, that's going to inhibit or limit their functionality. So again, our goal is to try to look and see what we can do to help them. We don't focus so much on bracing, although we can do bracing. Bracing is not something we shy away from when we find a need for it, but we very much like to focus in on the body itself and improve the underlying muscle and physiology. So I just wanted to show you a very broad array of garments that Axio can do. You notice that we can do any area of the body below the neckline. So in this regard, you know, you might, if somebody comes to us with paraplegia, of course, we would consider any one of the garments on the lower half of this pictorial. On the upper half would be for somebody who's quadriplegic, or maybe somebody with high paraplegia, maybe a T2, T3, T4 paraplegia would need something like the BioVest to help with their back muscles, middle and upper back muscles, as well as lower. So I want to give you some understanding of what we do, how we do it. And you'll notice on that left side, there's an arm that I'm sure everybody has seen. It's a typical posturing of the arm in somebody who has, say, a stroke or a brain injury. The muscles tend to spasms, and it forces this posture that you see. And that's a very unuseful arm. You really can't use that arm the way it is. It's contracted, and you can't get the arm extended. On the other hand, the right side, I'm showing you an individual who, by the way, has had paralysis for over 30 years when she came to us. And her arm was looking like the left side, but we made her arm straight. We got everything looking straight, extended, and loose. And now that arm is much more functional. That's what you want to achieve. And you can only achieve this if you can inhibit the muscle spasms and facilitate the muscles that typically are not working. And this will demonstrate that. So the bicep muscle that you see on the left side, that's typically a muscle that goes into spasm, and that will flex the elbow, and you'll see flexion of the elbow, flexion of the fingers and wrist. That's because those muscle spasms are so overpowering that any muscle opposite of that is not going to be able to overcome it. So when we stimulate muscles, we stimulate, for example, the opposite muscle of that spastic muscle. So the bicep, when it's contracted, that's what flexes the elbow, but the tricep, when that's stimulated, it will extend the elbow. And that's, in basic terms, that's what we do. We look to rebalance muscle forces, and the best way to do that is to utilize what you have as an individual. You have nerves, you have muscles. There is a lost connection between the brain and those muscles, so we step in with the electrical stimulation and do that for you. Then eventually, the brain may relearn that, may be re-educated and relearn those movements, and then you won't you will regain some of your functionality and usage. So in other words, in that fixed position, not very useful. In the extended position, much more likely to be able to use that arm again. And in a paralyzed arm isn't going to be 100% useful, but we can work our way towards, we can creep up the functionality so it becomes possible to use both hands at the same time. Now, the magic behind Axio's wearable therapy is, of course, the fact that you can wear this arm sleeve all day long. And when you do that, it provides you with a significant number of contractions per day to help keep that arm extended. But in the background, you are receiving signals that come from the electrical stimulation sleeve and stimulating your skin nerves or cutaneous nerves. And those nerves then send signaling to the brain to help the brain, and you'll see a better recognition of the arm and a restoration of usage, simply because the brain is now recognizing these muscles a little bit better, and it's also being re-educated and told, hey, this is how, do you remember how these muscles are supposed to work? This is how it's supposed to work. And that really does help restore the usage. People who have paralysis will lose that remembrance. Of course, they don't remember how to do it, especially if it's been years since their paralysis. They will have completely forgotten how to do that. So our goal is to retrain. Now, I just wanted to show you a little more scientific, of course, but this is where the rubber meets the road. So you can see in all those 4 categories of cerebral palsy, stroke, hemispherectomy, brain injury, these are conditions that result in one-sided paralysis. And the red bars represent usage meaning, like, what did you use? How much do you use that arm in a home environment or away from the clinic? And you can see the numbers are fairly low, 10%, 7.5%. These numbers are pretty low. And what we're trying to do with the wearable therapy sleeve is to boost that patient's ability or incentive to use the arm. And you can see the boosting that's taking place, 33%, 25%, 36%. These are not 100% returns of functionality, but these are major increases in usage of the affected arm. That's going to be very helpful for any kind of work productivity. Now, I want to show a little example of a case where we worked with. This was an individual that had left-sided hemiplegia, and when he came to us, he really didn't use his arm at all. As a matter of fact, it was about 5%. And, you know, this is after 10 years of therapy. And so if you can see, he had lots of things going on. It's a very complex case. So he had paralysis affecting the arm and the leg. And he didn't really walk very well at the same time that he didn't have a very good arm function. So despite a lot of treatments in the past, he just didn't really achieve what he needed to achieve to become more functional. Fast forward, he gets his wearable therapy sleeve, and it's now been 10 years. He's been wearing the sleeve for 10 years. David is now working. He's able to stand for 5 to 6 hours at a time. He's able to walk. I'll show you a video in a minute. Able to walk much better than he did before. But we estimate that there was a huge savings in cost associated with his healthcare, in addition to all the other great things that happened to David. So the wearable therapy system did away with his AFO, which you'll see in a minute. The walking was greatly improved with the stimulation. And let's see. This video is going to show you what David presented as coming to me before he got his wearable therapy system. And you're going to see the strength of the spasms in his leg, torquing his foot, and how difficult that would be to walk. Now, traditional AFO really could not fix this problem because the spasms in his foot and ankle were so strong that all it really did was just cause skin breakdown. In one visit, I would say, very first visit, I had David's foot corrected with the electrical stimulation. And it makes sense. It's the muscles that are the problem. So when we address the muscle with stimulation, it corrects the issue. So now he's turning on his device. It flattened out the foot. That gave David the ability to go to work. Prior to that, he wouldn't walk more than 5 minutes. Another case study that I thought would be of interest to you is Drew. Drew actually is an individual with complete paraplegia. When I say that, he is complete. He's lost everything below his injury level, which occurred in his neck. And in fact, he's on a ventilator because he doesn't breathe on his own. But you might think, well, what would wearable therapy do for this individual? The main thing is, just like we did for Christopher Reeve, we are keeping Drew's body in tip-top shape. Because atrophy is not a likable thing. It has very strong deleterious consequences, and we don't want that. So even though we're not trying to gain functionality with Drew, just by keeping his spasms down, his circulation good, his muscles healthy and strong, no atrophy, that plays a huge role psychologically for Drew to be able to sustain his quality of life and to be able to work and enjoy life. And I think this is the type of individual that we often think, holy cow, how does one overcome this degree of paralysis? I think this certainly is an attitude thing. Drew he's so driven, of course, and so amazing. But I know the Axio suit plays a huge role because he uses it every single day. In fact, when he was going through school, he didn't leave his classes. He didn't escape from his classes to go to therapy. He relied 100% on his wearable therapy system right in his dorm room. So that's quite an amazing story to be able to tell. His entire body was conditioned from the confines of his dorm room. And he uses it to this day. This is now 10 years later. And you can see this is still Drew, and Drew's leg muscles look very normal. That's hugely and psychologically helpful to Drew, knowing that his body is kept in shape, which allows him to focus on life and do other things than just trying to manage the deleterious consequences of his spinal cord injury. And this is an upright view of Drew, which of course, if I took away the table and the vent, you'd say, well, wait a minute, this guy's not paralyzed. And that's the point. We don't want our individuals looking paralyzed. We want to keep them as healthy and as fit as possible. And I think we definitely see that in Drew. And let's talk a minute or two about pain. Pain can destroy life. That's no doubt about it, because it has an effect on every aspect of your life. It can cause depression, loss of sleep, loss of earning potential, deconditioning, and etc. And you'll see that these things are all going against you. So how in the world is an individual going to go back to work under these conditions? It's very difficult to do so. We make various products. This is just showing you a vest. If somebody presented to me with chronic pain affecting his upper, middle, and lower back, this is a product that we would likely do. I wanted to show you this because this is this is what I typically see in the real world. So the red bars represent pain levels. And so, and the average pain levels, of course, that we see coming to us, six to 8. And 6 being at rest, and 8, of course, becoming, what you see when you become more active. Now, notice that at the rest level, Axio's product, on average, can lower pain to about 2. But notice it doesn't allow pain to rise. That is the quintessential reason why we can help people in pain get back to work. Because if we can control that activity-related pain, people can become much more functional and they can focus on doing things other than just managing their pain. So what is it that we want to do? What's our goal? Again, I mentioned our goals are the same as your goals. So we want to increase the number of successful cases you have, closures, improve employability, reduce job loss, rebuild confidence, emphasize non-pharmacological treatments, because I know that our system is a small sliver of what goes on in pain management, what goes on in medicine. We think that we can play a huge role because we don't have any pharmacological effects going on here. This is such a low risk treatment. We want to emphasize lifelong health. It doesn't help anybody to be able to work for 6 months and then run into a health problem. That doesn't do anybody any good. We can also help speed up your time to closure. And this is a case study that I believe will be discussed here.
Yep. Thanks, Phil. Hi, everyone. I'm Lindsay Randall, and I'm one of the specialists with the Business Network Division of MRS. And Philip's provided us with a ton of great information, including case examples from his own practice. So to provide some further context, we thought it might be helpful to give a quick example of an MRS customer that I met with, where I actually put AxioBionics down as a resource on their consult report that I had done for them and their counselor. So as you can see on the slide here, our case example, we're going to call him Steve. And this individual was rear-ended by a car while sitting stationary on his motorcycle about 10 years ago. And in his own words, this has caused just a domino effect of back issues for him. He has a herniated disc. He's had 5 back surgeries. He continues to have various physical limitations that are affecting, both his daily life and his employability. He's tried multiple rounds of physical therapy. He's tried medication. He's also going kind of as long as he can throughout the day, tolerating the pain. But in the evening, we'll usually put on a traction collar to try to relieve some of the pressure and the pain. But essentially, despite all these things he's tried over these past 10 years, he still continues to be in daily pain. And he vocalized something that I think we often hear from our MRS customers, and that's what his mind is telling him he can do, what he wants to do, his will to work, it just isn't matching up with his physical functioning, kind of no matter how hard he tries. And this has been tremendously frustrating for him. And he's someone who has tried some of the more traditional, if you will, pain management techniques, like Philip has mentioned, with the medication. He's tried physical therapy, he's tried different wearable like traction collar, and it's just not working, or it's maybe putting a dent in things or providing some temporary relief, but ultimately he's going back to kind of an average of 7 or 8 daily pain level. And so I happened to just tour AxioBionics while I was working on this report, and I ended up putting them down as a resource because it is more of an innovative approach to this chronic pain management that he hasn't tried yet, when he has tried a lot of things that are not working or only working temporarily. So we just wanted to give an idea of what a referral from MRS to AxioBionics could look like, just to give that general picture. Obviously, there's a lot of variety with our customers and a ton of people that could potentially benefit, but this is just one example to kind of get your mind thinking of who might be on your caseload or who might benefit. And I think we're going to dive a little deeper too. I see we've had some great questions in the chat about specific scenarios. So up next are some questions.
This is Christine. Hey, Philip. So we have had some good questions. So let's get started on that. First, Zachary asked, hello, Philip. I am thoroughly enjoying your presentation because I am a quadriplegic, C3 to C4 incomplete from a diving accident in 1997. Your slides mentioned that your product can help with posture, something that I'm very concerned with. What exactly does your product help with this issue?
So every spinal cord patient that has paralysis, either incomplete or complete, is going to have a spinal posture issue. That's very common. When we stimulate back muscles play a role, a large role, of course, in maintaining posture and stability. And when you contract these muscles, if they are weak, they may not perform the stability that you want early, but as these muscles become stronger, then you have the ability to maintain posture better than you could without it. Now, you can wear one of our vests in your chair during the day, and as the muscles are contracting, you will experience the improvements in posture and stability that is imparted from these muscles contracting. This is very different, let's say, from a brace, because a brace would certainly try to stabilize your spine, but obviously we have to be very concerned about pressure in spinal cord injury where sensation is decreased. I would prefer to let the muscles do the work, and in fact, that is very desirable. Sometimes people will have, a degree or two, or even more sensation than we think, and it can help with pain if there is pain present, because sitting with poor posture can tend to cause, a lot of discomfort, if not pain. So it can help with that as well. So I think overall, again, we're just looking at trying to restore a bit of normalcy to the spine. That makes a lot of sense, because at one time there was no issues, and we're just trying to bring people closer to that point where the muscles and the skeleton were more normalized.
This is Christine. Thanks, Philip. Okay, we have another question for you. Might there be an opportunity to utilize wearable therapy for facial nerve pain above the neckline? The example being working with an individual who has trigeminal neuralgia. Has that been something that you guys have tried before?
And not really. We tend not to treat above the neckline. Have I heard of it? Yes. Some individuals have done electrical stimulation on the facial nerves, the facial muscles. I've seen this, say, in Bell's palsy, where you get a drooping on one side of the face versus the other side, and electrical stimulation has been proven to be helpful for that. But yes, I think anytime that there is an issue that comes up, even if I haven't seen it, you can always test the individual. That's the great thing about electrical stimulation. You don't have to do a surgery. You don't have to take a drug. You can just simply try it. And usually we offer up, a reasonable amount of trial time so that we're not guessing whether or not something is going to work. We will know usually by the end of the trial how well it's going to work for the individual.
This is Christine. Great. Okay, so kind of talking about logistics. If this is going to be worn all day, how do you wash it?
Good question. Well, the good news is that because it's a fabric, it can be washed, and it should be washed. Typically, it would be hand washed, even with the wires. We don't ask people to remove wires, so it's fairly low maintenance. I mean, of course, people who wear our suits all day long need to be concerned about keeping it clean. If you're using it, say, in case in the situation that Drew does, which he wears it maybe one of the suits maybe for an hour or two. It's not going to need cleansing as often as if you're wearing it all day long. So there's some difference there. But everything that we make is washable.
This is Christine. Thanks for that clarification. Now, I had a question because you just mentioned Drew. Now, on your slide, it said that he was injured at 15. How old was he when those pictures were taken? Just to give us some idea.
So the first picture that was taken was at 15. Well, it was a 15 or 16 because I got to him probably within 9 months of his injury. And then the picture of him showing himself buff was taken just, I would say, 8 years afterwards.
Wow, that's remarkable.
So yeah, so we've been able to maintain his muscle, and you can see he certainly didn't lose any muscle, right? So in this case, that plays a huge role in anybody, of course, anybody who's young is going to be focused on body image, and as they should, and it should be helpful to an individual with spinal cord injury to not worry about that.
Yeah, I'm glad, Philip, that you mentioned if you had removed all the devices around him, he would look like anyone standing there. That was
Probably,
pretty profound right there.
yes, probably he could be on the football team.
Right, right. Okay, so we have another question. Would this product be appropriate for recovery workout? Meaning if someone is experiencing pain after a long workout, does it assist with body recovery?
I don't have a lot of experience with that, but of course, one of our indications for use is the increase in blood flow, locally speaking. Like if you're exercising arm muscles and you're sore, we can certainly promote and foster blood flow. And that will clear out lactic acid, which is the source of muscle soreness. So I suspect it probably could work well.
Okay, probably not typically your customer base, but something.
We've traditionally have focused, and my passion anyway, has been these individuals we're talking about. These are the ones that need the most help. And yes, of course, lots of even non-injured people could probably use electrical stimulation, but nothing drives me more than just trying to help the individual that succumb to disability.
Mhm.
That's hugely rewarding.
Absolutely. So a lot of us on the line have heard of TENS units before. Could you tell us how your product would be similar or different to one of those?
Well, our system, it is a TENS. TENS really just means transcutaneous electrical nerve stimulation. So, of course, our system is transcutaneous, it's electrical, and it's a nerve stimulation. But what's different is that we employ not only what we call subthreshold motor stimulation, which is typically the softer stimulus that doesn't contract muscle, but we also employ the suprathreshold motor stimulus that makes muscle contract. That's the difference. So when you're trying to control pain, you don't necessarily try to contract muscle. You're just using it at lower levels to obtain that relief. But our system can go beyond that. And in fact, muscle contractions are very helpful for relaxing muscle spasms, which are very helpful at reducing pain. So oftentimes you're going to see people come in and complain of both muscle spasms and pain. It's sort of the core of what people complain about. So if you can get pain down, the spasms will typically decrease. If you get the spasms down, the pain will typically decrease. And that's the beauty of what we do, is we tend to make both of those components decrease. That's we find to be super helpful.
Excellent. And just to clarify, AxioBionics is an MRS vendor.
We are.
Okay, excellent.
Yes.
And what's the process as far as a referral with your company? What kind of information do you need, and how can we start that if we have a customer?
Yes, well, Axio does need a referral to us from you, obviously, but before we can do anything, Axio is going to contact the client's physician, because we don't do anything outside of the physician's understanding. So we will give them a prescription request, but also give them some description of what we're about to embark on, why we're doing it. So the physician will know what it is we're going to do or what we want to accomplish. Usually physicians are not opposed to doing anything that we do because, number one, it's not invasive, it's not pharmacological. So the risks are very, very low for what we're about to do. So if you get us a referral, then we can take it from there. That's how we would always start, number one, with an evaluation. We never say, hey, here's what we think you should purchase from us, because we don't know. We're not going to know that until we have substantial time with the client trying to understand what it is we need to fix. Once we come to that conclusion, then yes, we will approach you with a recommendation.
And you guys have a wide range of products. Could you kind of give us an estimate of what a typical cost could be?
So yes, indeed, because we treat one muscle and sometimes we treat all muscles, the range of costs can be, considerable. So you might see something for, say, $3,000-$4,000, and you might see something for $20,000-$30,000. There is a big difference, because obviously the more muscles, the more area covered, the more complex, that will govern the cost. The good news in all of this is that the system, as in, I'll give you, the Drew case again, that Drew got his system and he uses it every day for multiple hours. He's been doing that for 10 years. Imagine purchasing a system that you can use for years and years and years without having to buy a new system, how much more muscle therapy you get, because typically you can get, say in Drew's case, 2 to 4 hours per day. In some cases, you might get 12 hours a day. So imagine the degree of muscle therapy you're getting out of the system in comparison to, say, traditional therapy. Yeah.
So kind of speaking to different stages of disability at this point, Philip, what stage do you see to be the most useful, right? You mentioned something about Drew. You guys met him about 8 months post. Could you kind of tell us what you've seen as far as when clients have come to you immediately after an injury or maybe years after an injury?
I would love for all clients to come to me as early as possible. That is definitely, without a doubt, the best. But that's not our real world. And, I say the good news is that typically we can treat anybody at any stage of their disability. It all comes down to that evaluation. Not all patients will be candidates, to be honest. Obviously, we want to screen those out. We've had cases where people with brain injury come to us 30 years post injury, and you would think to yourself, well, wait a minute, what are you going to do with that? And it turns out that a lot. And we can get that arm function improved. We can relax those hand muscles and get them. Just getting a hand to open up like that is huge. Believe it or not, that's huge. Some people have so much contracture that's very uncomfortable. Now, it's a win to get the hand open. It's a super win when you can get a little more individual finger motion. And it's a super win when you can actually see clients actually using the arm in a function for the first time in 30 years. That does happen.
Excellent. Well, I think we have all of our questions addressed from our audience. So thank you for that, Philip. I'm going to see if send it over to Lisa, and she can kind of wrap us up as far as additional information about AxioBionics.
Great. Thank you, Christine. And thank you everyone for the questions. And I am able, my email's on this page right here, copy bartleyl@michigan.gov. So if you have any other questions that weren't covered, please feel free to reach out to me or to Philip. And this is a business spotlight. So we want to talk about jobs. And while AxioBionics is located on the west side of Ann Arbor, Scioto Township, they do have some positions that could be remote. And that's why I felt like it was worth talking about them. Because positions such as the graphic designer for doing video or sales, could be statewide. This is a product that is used nationwide. So, if somebody has interest in those two positions, definitely statewide. But locally in the local office, they're looking for industrial sewing machine operators, quality control, electric component fabricators, shipping and assembly team, and the front desk, reception and data entry. I'll give Philip a minute to talk about them, but I wanted you all to know that they are posted on Pure Michigan Talent Bank if you want more details. But if you've done one of these jobs and you want to go ahead and send a resume and a short cover letter saying what job you're looking for in your email and copy me, you can do that. And even if you want to talk about the jobs with me, I'm happy to kind of walk you through what the jobs are like. I've been over on a tour over there. I've spoken with Philip and a key member of his team, so I can help you. But I will give Philip a minute to talk about some of these jobs. And if anyone has a question about these jobs, we can answer those as well. We have a few minutes. So Philip, if you want to chat about the jobs, you can do that.
So like any other company in this era and time, we are challenged trying to find individuals. So, but what that means is that we do have openings, and we'd like to fill those openings with people who are qualified. And of course, everything we do here is centered around creating our product. We require some individuals to be able to sew, some individuals to be able to assemble, and be able to do some computer work. Quality control is usually a combination of things. But nothing here requires any heavy lifting. It doesn't require anybody to have to use their body in a manner that would be ultra stressful. So that's kind of the good news, is that we're not asking for anybody to come to us where we would expect them to do something maybe a little more stressful than they're used to doing. But yes, we would love to see anybody around the state who thinks they can do sales for us to connect with us, because we have a big job ahead of us to get the information out there to the physical therapists and to the doctors, to the case managers. And so, we want to bring this full circle, right? I mean, we'd love to be able to help those that want to work. And if they have disabilities, of course, we want to be able to help them overcome their disabilities so that they can work. So bring it on. Great,
thank you. Also, I want to let everyone know that you've signed up for today. You will receive a follow-up email with a recording. And there are a couple of questions I know we didn't answer, but I'm going to get those answers from Philip. I'm going to send them in the follow-up email. And also, if I have the job descriptions, I will try to send those out as well. So there will be more information. But like I said, both Philip and I, we can go to the next slide and everyone can see your contact information as well. We're both an email or a call away, and we're happy to discuss the positions, the technology with you. I'm the positions, he's the technology. We did a couple of tours, and if there was a lot of interest in another tour, I bet Philip would invite us to another tour as well. So if you're interested in something like that, please let us know. We are so glad that you were with us today, and we loved all the questions. And Philip, thank you so much for sharing your technology with MRS and my colleagues and some clients potentially or customers. We know that this has
Thank you.
been a great information. Did somebody have a question? I heard something. Okay. Well, Philip, again, thank you for joining us. We appreciate this, and everyone will
My
receive
pleasure.
the recording, and we'll give you back about 5 minutes of your day. And we thank you all for joining us. Have a good day.
Thank
Bye-bye.
you. Bye-bye now.
Thanks.